so this video is going to explore the options for estrogen therapy, feminizing therapy. And the reason I will not be discussing testosterone blockers in this video is because I've already done another video entirely that tells you exactly why you don't need testosterone blockers, because high-dose estrogen therapy will suppress your testosterone on its own, blah, blah, blah. Go watch that video if you're interested. Anyways, so with estrogen therapy, you have several options. And really and truly, you may start with one and it just doesn't work for you. We're going to work through that. Not everybody is the same, obviously. There's genetic differences and everything going on here. So you may start off and say, I want to start with patches and they don't work for crap. And so then we move to pills and they work great. Whatever. So don't get too hung up on what you think someone else is using that works great or whatever. It may not work for anything for you. So let's talk about what the options are. The three most common are going to be pills, patches, and injectable therapy. Now, injectable therapy, you can do intramuscular or subcutaneous injections. There are two different types of injections. The differences between those two types of injections are discussed in yet another video in case you're interested, but just know there are two different types that you can do. Anyways, so let's start off with pills because everybody seems to be pretty familiar with that. So pill form of estrogen, the kind that I prescribe anyways, the more bioidentical kind, you're going to take it under the tongue, let it dissolve rather than just swallow it, because you're going to get about 30% more of the medicine by dissolving it under your tongue rather than swallowing it, because the liver will eat it up. If you just swallow it, you're wasting your medicine right there. Anyway, so dissolved under the tongue. I will have you also take it several times a day, at least 3 times a day. And the reason for that is the strength behind those pills are only going to last about 6 hours before it starts tapering down sharply. So if you think about it, these poor folks that are walking around and they've only got like 1 time a day that they take their estrogen pill, pretty sad, because the strength of that pill is going to last for about 6 hours and then it tapers down sharply. So for part of the day, they're not really going to have a whole lot of hormone coming from that dose that they took. And in fact, they'll get down to just about nothing. So it's not really great for transitioning to have a once daily estrogen therapy. It's just kind of ridiculous, actually. But anyways, that's just, you know, my opinion, and also basic math whenever you do the whole 6 hour thing. Anyways, so you would take it at least 3 times a day. And like I said, the reason for that is because of how long the strength of the pills actually lasts, so that you keep exposing your body's cells to high levels of estrogen throughout the day by pulse dosing, taking those pills several times a day. Anyways, so that gets kind of annoying for a lot of people. Obviously, you know, you forget some, whatever. It's okay if you forget a dose here and there, you know, it's not the end of the world, or if you take one late or a little bit early or whatever, you know. I mean, we're also trying to mimic the ovary here, and ovaries don't just release estrogen on a schedule throughout the day. You know, they kind of and release some several times a day. So we're also mimicking the ovary whenever we're doing this several times a day dosing with pills. I do find that the vast majority of individuals do not get the kind of levels that I'm looking for with pill therapy. And that's for a variety of reasons, but pills just tend to not absorb very well, even whenever you're doing the under the tongue dissolving and everything. You know, the levels I'm looking for on estrogen, whenever we're checking your labs, like the estradiol, I want, you know, at least at 200 or so. I mean, that doesn't mean if you don't get to 200 that it's bad or whatever, but that's the goal I have, is to get you to 200 and beyond or whatever. And a lot of times with pills, I see that people kind of get undershot there, even on a, you know, dose of like, I'll start people off with 2 milligrams 3 times a day, so a total of 6 milligrams. I'll go up to 12 milligrams total a day, and they'll still just barely be brushing that 200 level during their trough, their low level, by the way. That's where I measure labs at, is at the trough or your lowest level of hormones. And so I find that pills a lot of times are a good way to start with hormone therapy, but I'm not too keen on people continuing them long term, at least not at those high doses, because one, it can be harsh on the liver over time, and as you age, it can be very annoying. The pill burden of having to take it several times a day, you'll start getting annoyed with it, getting lazy, sloppy, and everything. So anyways, but it is a good way to kind of ease into hormone therapy and start getting your levels elevated. I do find that I'm able to suppress people's testosterone levels with fair ease on the just the 3 time a day 2 milligram tab starting off. So like I said, it's a decent way to start, get your testosterone level down and start increasing your estradiol levels and everything, and kind of ease into it. Anyways, so next up is going to be patches. Not a lot of people know about patches, but they are an option. They're kind of nice in that they provide a steady stream release of hormones, so you don't have the ups and downs throughout the day or the week whenever you take pills or injectables. So that can be kind of nice, a little less side effects. You know, the hot flashes and sweats and mood swings can be a little bit lessened whenever you're starting on hormone therapy, if you have a nice steady release of hormones from a patch. The only thing that kind of sucks is that the dosing was created for cis women. So you usually have to start off with the high dose patch, and whenever you do that, if you need to go up on dose, then you're wearing more than one patch, and that's usually a pain in the butt, but what can you do? The kind of patches they have, you can wear once weekly or twice weekly. I recommend the twice weekly ones because the once weekly just don't seem to stay quite as stuck as they should by that 5th, 6th, and 7th day. Some people do, but a lot of people, I find it's just easier to do the twice weekly patch and just change it out then. Anyways, side effects that you might experience on patches that you don't experience on the other estrogens would be a skin rash, and that's mainly from the sticky part of the patch. And I find a decent amount of people get that, like 15 or 20% of people that go on patches will complain that they get a rash. Now sometimes it's just like you take the patch off and your skin's a little bit pink, not an actual rash, just pink, and that can be the vasodilation of the blood vessels there just underneath that patch. That's okay, it's not really like detrimental or anything, but if you have an actual rash, a skin irritation, that can be problematic, not just from an aesthetics point of view, but also it can be preventing you from properly absorbing the medication through the patch. So that's something to be aware of as well whenever we're doing your levels. If you want to throw out there, oh hey, by the way, Stacy, I've got this rash, so if my levels are low, that might be a problem. Because I mean, what's the point of me increasing your patch dose if you're not going to absorb it appropriately anyway? We may as well change to pills or injectables or something like that. The other problem people have is patches actually sticking to them. If you've ever had problems with tape sticking to you, then you will have problems with the patch staying stuck on. Just don't even bother trying them. People I know have done all kinds of things, from getting a clear Tegaderm dressing to protect them, or just putting an extra piece of tape over there. That's fine and all if it works for you, but I mean, honestly, if you find that you put it on and like one day later the sticky in it is just not sticking, you're just one of those folks that your skin chemistry just knocks out any form of sticky product, I just wouldn't bother with patches. You're probably going to be wasting your time. Anyways, so next up would be injectable therapy, and like I said, you can do it subcutaneous or intramuscular. There's a different video for that if you want to know the difference between those two types of injections. There's no difference in dose between the two that you take. So with injectable, the thing that's kind of nice about that is it's not like a daily thing that you're having to worry about. It's like you do it and you're done. It's already in your body. You're not having to take pills several times a day or worry about a patch staying on. It's already in you. You're good. But anyways, so I usually will start people out with once weekly injections. And like I mentioned in my testosterone video, I will adjust the frequency of injections based on your response and any, side effects you might have, such as moodiness and whatnot. Some people need to go up to every 5-day dosing. Some people can do every 2 weeks, although it is more rare for people to do every 2 weeks on estrogen therapy, especially in the beginnings, like first few years of their transition, but not completely unheard of. And then you can also do microdosing, just like testosterone. You can do microdosing with estradiol, which is where you inject a very small amount every other day or twice a week. And that way you don't have such highs and lows in your estrogen levels, so it can help minimize some of the moodiness and maybe the hot flashes or sweats or something that some people get. But anyway, so it's kind of nice in that you put it in you and you don't have to worry about it coming off or remembering to, take these pills several times a day or anything. That's kind of nice. I mean, the downside, really the main downside to injectable therapy is it's injectable therapy, and not too many people are very keen on injecting themselves. People all the time are saying, oh, but I heard injections with estrogen are much more powerful than pills and patches. they are correct. I think it's really just that you're so much more able to go up on dose just more easily with injectable therapy, whereas with patches, you start adding patches and stuff. It's just you start feeling like you're a big sticker thing, and with pills, you have to take so many freaking pills to get your levels up high enough. I mean, you'd be full, you'd lose weight because you're full of pills all the time. So, so the benefit of injectable therapy then also becomes that you can adjust the dose up and down a little bit easier, and so you can affect your levels quicker and easier with that as well. That's not to say that injectable therapy is the best estrogen therapy or anything. I know people like to go around on the internet and say it, but for some people it's just not an option. You know, they have super sensitive skin, or they might have like I don't know, just eczema in all the wrong places where they would need to inject, or just something like that. And I have seen just a few people who are just poor absorbers of injectable therapy, which is odd, but it does happen. And so then, you know, pills and patches are the alternative for them. Like I said, there's no problem with starting off with one and changing to another, or even another, or going back to another. Everybody's different in how they respond, and as you grow and age and change, your body's needs change too. So what dose you start out on in the beginning may be reduced a little bit whenever you get to a point where you feel like, all right, I've come a pretty far way, and I don't feel like taking all this medicine all the time and feeling so moody all the time. We back it down by 25% or something like that, just so that you feel good and you're maintaining your changes, and you're going through life. You're just living life. So anyways, so pills, patches, injectables, three main options there. And oh, I guess I could have mentioned difference in price. So the difference in price between them is not huge, but it is, you know, something to be considered. So pills are usually the favored here price-wise because, let's say, so if you're taking 3 times a day of a 2 milligram tablet, that's 90 tabs a month. And that can run you with a good RX coupon somewhere in the neighborhood of like 10 to 25 bucks a month. You know, fairly reasonably cheap. And if you buy like a 90-day supply at a time, sometimes you can get a discount, you know, even further on that. Patches in general, with a good RX coupon, of course, they're gonna run somewhere between $30 and $45 a month. Just kind of depends on the pharmacy you go to. And then injectable therapy. The problem with injectable therapy is every year it seems like there is a shortage that happens. It's like the manufacturer is just too stupid to figure out that this happens every year, so they need to make more. And who knows what that's about. I mean, maybe it could be that more folks are feeling better about coming out and going through the transition that they want and everything. And so then, you know, you end up with a little bit less of a supply each year because more people are living their dream and everything. But anyway, so price-wise on that, when there's not a shortage happening, a vial of it that usually lasts somewhere close to 90 days, not all the time though, and just like I said, depends on your dose, highly dependent on your dose, but at least a 2-month supply, more than likely a 90-day supply, is gonna run you somewhere around like 60 to 80 bucks for a vial. So, you know, 60 to 80 bucks for like a 2 to 3 month supply. Whenever that shortage hits though, like right now, whenever I did this, and this is June 2021 right now, there seems to be a shortage now, and you'll see that the vials, the 2 to 3 month supply now is running anywhere from like $80 to $130 for a vial. So the 2 to 3 month supply has, you know, gone up quite a bit. And then there's the added annoyance of, you know, you send in the prescription and the pharmacy can't get it, and so you have to call around and figure out which pharmacy has a better supplier or whatever. So injections can be kind of annoying in that respect because it seems like it happens every year, and it just doesn't seem like there's an end in sight for that. Very annoying. But anyway, so pills, patches, injectables, no need to get hung up on one particular one because, like I said, it might not work the best for you. If you are kind of leaning towards doing pills, however, I do encourage you to watch another one of my videos. It's called something or other to do with like the problem with estrone, which is a particular type of estrogen. There's many different types of estrogen, but estrone is a particular pain in the butt. So if you're looking towards pills, look up that video that has estrone in the title, because there is an issue you can run into when using pills, where you convert your powerhouse good estrogen, your estradiol, into estrone, which is rather weak, and that can be somewhat problematic for your transition and whatnot. So anyways, if y'all have questions or anything, you know where to find me. As always, have fun.